Hi, I'm Nush from Why Be Aligned, and for this week's Movement Monday, we are looking at the rib cage. I'm sure we're all familiar with the rib cage, but this is just a great picture here to show you how the ribs wrap around the lungs, and we also have the diaphragm sitting at the bottom of the rib cage, so it's a huge part of breathing mechanics. Our rib cage can move in 3 planes of motion and also have another movement specifically tied into breathing. Let's have a look at them. In our sagittal or side-on view, you can see in this anatomy app video, we've got this backwards tilt of the rib cage and forward. Those are our posterior tilt and our anterior tilt. In our frontal or front-on view, we can see we've got this tilting to the side, and this is called lateral flexion. And in our transverse or twisty-turny plane, you can see we then have rotation of the rib cage. We then have expansion and compression. Expansion is when the ribs are lifting up and away from each other, and then compression is when they're coming back down and in towards each other. I'm aware that the tilting of the rib cage can look a little bit similar to the expansion and compression, but they are different. With our tilts, we have the whole rib cage as one unit, either tilting upwards and backwards or forward and downwards. So it's this side on tilting movement. Whereas with the expansion and compression, the difference is the ribs are opening and moving away from each other. So there is a lift, but it's what we would do when we're breathing in. The ribs would open up to allow those lungs to fully inflate. So it's expanding, and that is expanding top to bottom, side to side, and forward to back. And then when we compress, everything comes back in as the lungs deflate. So it's not a tilting, it's an opening. Think of it as like there being a balloon inside, which inflates, that's our lungs. And then as the balloon deflates, everything comes back in to close around it. Hopefully from understanding the expansion and compression of the rib cage, you can see how it would impact our breathing. If we're not able to really expand the rib cage, we can't fill our lungs well. And if we're unable to fully compress our rib cage, we also can't deflate our lungs, and they will have effect on the diaphragm as well. So it just goes to show that our rib cage really is a big factor in our breathing mechanics. Another thing that is hugely affected by our rib cage is our spine. Now, in our spine, we have different sections. We have our neck, we have our lower spine, and in the middle is our thoracic spine. This is the section that runs through the rib cage. It quite literally attaches on. So we have our vertebrae here at the back, and our ribs will wrap round, attach onto these 12 vertebrae, and then wrap round to the front and attach onto our sternum or come down underneath it. So you can see how it literally forms a cage, our rib cage, attaching to the front and back of our body. So if the ribs are all attaching to these vertebrae, if the rib cage does not move well or cannot move, then it's going to be difficult for the spine to move, and vice versa. If we cannot move our spine well in our thoracic area, then our rib cage will not be able to move well. So let's get some movement into our rib cage. So first in our sagittal or side-on view, we have our posterior tilt and our anterior tilt. Now, if you're someone with a very curved lower back, I would suggest just thinking about tucking your tailbone a little bit between your legs. It's going to start slightly reduce that arch and not put pressure on it when we're moving the rib cage. So initially we want to think about our collarbones here coming upwards and trying to sort of hook over our shoulders. So it's up and over. And this is just going to give me that tilt backwards of our rib cage. And then you're going to let those collarbones start to come back down to the floor, and think about this part of the rib cage slowly softening down and backwards. So you can hopefully see at the back of my ribs, I lift, it comes forward, I relax, and it goes down. What I'm not doing at the end of the movement is using my shoulders to hunch forward and round the back. It is simply just a relaxation. You can tie it in with your breath, a breath in, and a breath out, and just keeping that head over the shoulders and the shoulders not coming forward and back. In our frontal or front-on plane, we want a bit of a seesaw movement with our rib cage. So what you can do is think about your hands, nice straight hands just pointing down towards the floor, and then you can gently stroke one thigh with one hand, and you'll see that's tipping my rib cage in that direction. So I'm getting this slanting movement in the rib cage, and then I'm going to lift up and I can stroke down the other leg. And so it's giving me this seesaw movement What you can also do when you feel like you want to go to the next level is perhaps put your hands on your chest, or one up and one down, and think about trying to recreate that movement, but without using your hands. So it's thinking about tipping one side of the rib cage down to the floor and the other side up into the air, then vice versa. So it's down on one side, up on the other, down on one side, up at the other. Just being careful not to pop the rib cage out to the side when we do it. It's simply like I had a pen through here and I'm just moving off that axis like a steering wheel. And then in our transverse or rotational plane, we're simply going to rotate our rib cage round one way and then rotate it the other way. But what we're just making sure we're doing is keeping our pelvis facing forwards, because otherwise we won't actually get any rotation in that thoracic spine that we want. So we've got our rotation there. You might find it's easier one way, harder one way, but be sure to do it really gently and slowly. There's no rushing in this movement. It's just a really slow rotation round a circle. Then for our expansion and our contraction, we want to really inflate our lungs. So we want to do a lovely big in-breath. However, when we do that, you don't just want to breathe up, because that's just going to tilt my rib cage backwards or back and forth. We also don't just want to breathe, say, into our belly, because that doesn't really do much to my ribs. Unfortunately, you can't see them spreading and opening and closing on this top. I wish you could. But what we want to think about is that we're getting this opening movement and all of the rib cage is expanding. We're getting a top to bottom expansion, a side to side, and a front and back. So a lovely way to do this is breathe into the base of the lungs first. So I'm coming out side to side and then breathing into the top of the lungs as well. And then perhaps try a little bit side to side again. And you should at this stage feel like all of the ribs are moving away from each other, opening up, and then breathing out. You could see my rib cage deflating like a balloon. In there, my lungs are literally deflating. So it's a nice big in-breath, thinking about filling up this whole rib cage cavity. Feeling those ribs spreading away from each other. You might even feel a bit of a stretch in those muscles that live between the ribs, our intercostal muscles. And then everything compresses and comes back and shrinks. So now we know a bit more about our rib cage. We know the movements it's able to make. We know why it's important for it to make those movements, and we also know how to get those movements into our body. With the practices, you only need to do 5 to 10 reps, perhaps once a day, just to get that movement back into the rib cage, back into the spine, and you should really feel a noticeable difference in your breathing and in your movement. Don't forget to like and subscribe so you don't miss out on next week's Movement Monday.